Hello, everybody. Welcome to our Medicare Made Easy webinar. My name is Sandra Jutton, and I'm an account executive here at the Schatz Benefit Group. Schatz Benefit Group is an independent broker, and we do have a partnership here with Education Minnesota. We really are your designated broker to help with all healthcare coverage options in retirement. Schatz Benefit Group, we do maintain our appointment shifts with all the large carriers in the state of Minnesota, as well as smaller ones too. And we really are the agency that offers you these exclusive group plans as well as your spouse. You'll see here we have several carriers listed. Specifically, UCare and Medica are the insurance carriers that designed these Education Minnesota plans here to be very competitive alongside the individual marketplace and what products are available there too. But you'll see Blue Cross, Health Partners, Humana, United Healthcare. Really, we do have this smorgasbord of different plans for you to choose from. Again, UCare and Medica specifically made these to be competitive for you. In case there's anyone in the audience who may be further out from turning 65, here's what a standard Medicare card looks like. So it's a red, white, and blue card. It does come to you in the mail from your Social Security office. Fun fact is you're always eligible the first of your birth month. So let's just say your birthday is March 15th. You're eligible to start Medicare then as of March 1st. If you are collecting Social Security when you're getting ready to turn 65, they do send this card out to you automatically, so you are automatically enrolled into Medicare Parts A and Part B. They're pretty good about sending these out 3 months prior to your birth month. So your birthday's in March, they're going to send this out probably the beginning of December. You are not collecting Social Security. You are not automatically enrolled into Medicare. If you do want Medicare to begin, you do have to apply for it online. And again, that's if you aren't collecting Social Security. Original Medicare, really what that means is Part A and Part B, and that coverage is the same for you, your spouse, your neighbor, your friend down in a different state. Now, Part A is hospitalization. Part B is medical. Those two pieces are only partial coverage for those types of services. And really that is why we as brokers step in, is to help you figure out, what type of plan is going to help you fill those gaps that Medicare leave you vulnerable to. What type of plan is going to be most suitable for you based on your needs specifically. That's where we kind of come into the private insurance companies. So Part C, Part D, Medigap, these are all, again, types of policies that are offered by private companies. Part C is really referenced as an Advantage plan. You hear Advantage, that means Part C. Typically, these plans also include that Part D drug benefit. When you go with the Advantage plan route, you're kind of getting everything all encompassed into one plan. So Advantage plans, they come in and they place an out-of-pocket maximum on that policy. So now there is predictability with Part A and Part B of what you could spend. Now these plans will have a very broad range of premiums to choose from. So, the closer you are to a $0 premium, the higher your out-of-pocket will get. Advantage plans, they throw in additional types of benefits that Medicare does not typically give us coverage for, like things like vision, hearing, and dental. Now, if we sidebar that other plan is a Medigap type plan. Now, Medigap plans are going to be very different from the Advantage policies. They really follow the rule of what Medicare covers, they will cover. So you're not going to find things like your vision, hearing, and dental with a Medigap plan. Medigap plans are more, I like to kind of say, Cadillac type coverage. They start with a very high monthly premium to give you more of a zero copay type plan. So you're paying more so on the forefront really to not see a bill. Now Medigap plans, they don't include Part D, which is the drug coverage. That's always the easy one to remember. And so if a Medigap plan appeals to you, we do have to also pair it with a drug plan. So that'll hike that premium up a little bit more so. And then if you do want that additional type of coverage, again, like vision, hearing, and dental, it's kind of like an a la carte option. So we have to keep adding those on. But a Medigap plan can be very appealing, again, if you are potentially a higher user of medical and we know you're someone that hits an out of pocket fairly quickly, or again, every calendar year. So it does make sense to go with a higher premium plan to offset, your costs throughout the year. What are these things going to cost us? Part A is a $0 monthly premium. That one is $0 because we actually pay into Medicare Part A our entire working career. Part B does have a premium associated with it, and this can change calendar year. $164.90 is the 2023 standard Part B premium rate. However, if you fall into higher income brackets, it can fluctuate based on where your income falls into play. It always changes too, so they're looking at what you made 2 years ago from the calendar year that we're in. Part C, again, as I mentioned, Advantage, $0 premiums up to $300 and above premiums. You know, in the premium range of how much coverage you want for yourself and really whatever out of pocket you're comfortable with. And Part D, these plans, they can have a premium anywhere from $7 a month all the way up to $100 a month. You know, if you're taking little to none, then we're going to keep you on that lower premium spectrum. If you're someone that might be on more name brands that are filled very consistently, we might have to go with a higher type of premium so that way the coverage for your drugs is better. And then Medigap, as I mentioned, those start high, a Cadillac type Medigap plan that you want for yourself. I do like to talk 3 major enrollment periods in Medicare. These are the 3 that are the big ones. Initial enrollment period. This is the 7-month window of when you're aging in, so turning 65. The 3 months before your birth month, your actual birth month, and then the 3 months after. If your birthday's in July, that means the beginning point of your initial enrollment period is actually April. This is that time to decide, am I going to go with Medicare or am I going to defer it because I'm going to continue working? Annual election period, this is really referenced as open enrollment. This is the same time every year, October 15th through December 7th. This is that window of time to figure out, okay, do I need to look at changing my plan for the next year? You know, did my situation change? Did my plan change? So really, really good benefit to take advantage of during that time frame. And then the last one we have is a special election period for folks that decided to continue working and you're 67 or 68 and you're thinking, I'm going to retire now. You can choose to retire and put Medicare in place following your retirement month. If you're thinking April you want to retire, great. Let's get Medicare put in place then, you know, May 1st for you, so that way everything is all lined up. There's no lapse in coverage. You, again, can retire at any time after turning 65 and elect Medicare. I like to talk a few key pieces with each one of the different types of plans, just so you have kind of a basic idea of how these plans work. Again, Medigap, you might hear these referenced as a true supplement plan. So when you hear true supplement or Medigap, that really means the same thing. Some highlights with these plans is they're really allow you the flexibility to go anywhere Medicare payment is accepted. They give you that flexibility. You know, if that clinic, that facility is going to take Medicare and willing to take your insurance, then you're really golden there. Another huge highlight is if you ever were to permanently relocate to a different state, these plans will, you know, travel with you. The thing to remember too is that it does not include Part D, the drug coverage. So if you do want a Medigap plan, you really need to pair that with the drug plan so you've got Part D. Your biggest takeaway from a Medigap plan is really that Medigap plans are the only plans left on the marketplace that still have health history questions on their application. Medigap plans will give you what's called guarantee issue, which means the right onto the plan, no health questions asked, as long as you do so when you're new to Medicare. When you are new to Medicare, you have that window onto these plans. Whereas maybe you went the Advantage plan route when you first started, and 5-10 years down the road, you're thinking that Medigap plan could be more appealing to you. You know, you run the risk of maybe not being able to get on it based on how you answer health questions. And that's really your biggest side note with Medigap plans is the guarantee window is when you're new to Medicare. Next one here is the cost plans. There are only 21 counties left in Minnesota, and those are kind of shaded in that light green. These specific counties have the availability to do Advantage, Medigap, or cost. And cost plans, it's really kind of a cross between an Advantage and a Medigap plan, because you can have the medical with one carrier and the drug coverage with a different. Cost plans are really only available in those areas still moving forward. Advantage plans, so remember again, these are coming in, they're taking care of Part A and Part B deductibles and co-insurance and placing it out of pocket in place for you. So now you actually have some predictability if you use your insurance of what you could spend. These plans don't stop there. They offer the vision, the hearing, and dental as well too. So they're throwing in those additional type of benefits that Medicare does not give us coverage for. Typically, again, they include the Part D, so you have the drug coverage with it. And they do use networks, so we always want to make sure we're looking at whatever carrier covers your prescriptions, your doctors, your specialists, your travel, all encompassed in one in that policy. Those are really how those plans work. Now, Part D, again, is the drug coverage. And we have this big stipulation with Part D and what's called the donut hole. They also reference that as the coverage gap too. Only everything to do with your drug coverage. The donut hole has absolutely nothing to do with medical, nothing to do with hospitalization. In Part D world, there's unfortunately no out-of-pocket cap for what you have to spend for your prescription. So that's why we have the risk of what's called the donut hole. Just briefly kind of talk about the 4 stages with Part D. Some plans will have a deductible and some plans can have a $0 drug deductible, which is stage 1. Dependent on your plan, you might have to satisfy a drug deductible before you get the better cost for your drugs, which would hit you in stage 2. Let's just say you went with a $0 drug deductible plan and now you're in stage 2. This is our initial coverage level, and that's really the best place to be. This is where your copays are usually the best for all types of prescriptions. In order to hit the donut hole, it is when you and the insurance carrier have met a total cost of your prescription that exceeds $4,660. You might be paying a $30 copay for your inhaler in stage 2, but the retail cost of that prescription is $1,200. That is what has to go into the calculations to hit stage 3 and you're in the donut hole. And now that copay that you were paying in stage 2 will change to 25% of the cost of the drug in stage 3. So you can come out of the donut hole and hit that 4th stage, which is called catastrophic coverage. And in order to come out of the donut hole, it is when you and the insurance carrier have exceeded a cost of $7,400. Once you've hit that, now you're paying only 5% of the cost of your drug. Like to know is you can get relievement and come out of that donut hole and have that co-insurance again drop down to 5%. I've seen people hit all 4 stages in 1 month before. It just depends on the prescription you're taking. So all the more reason to be very mindful of this when we have prescriptions we're taking. So that's really Part D. I like to throw in kind of an example of what those costs look like just so that you've got an idea. This is really how that could work here. Again, these are no concrete numbers on anything. It's just to give you a visual kind of how that would work. I do get questions all the time on, what are things I should really make sure I'm paying attention to with selecting my plan. It comes down to a few different things. The network, making sure you can see your doctors, your specialists, you can travel and do the things that you were doing with your insurance prior, or maybe things that you couldn't do with your insurance prior. The formulary, making sure that your prescriptions are on there. What one insurance carrier might, categorize your inhaler as a tier 4, which would be a very expensive inhaler. One insurance carrier might have it as a tier 2, where it's a very cheap one. So there are so many different things to look at with your insurance policy. So it is so important to check these all off here. Out of pocket is important too. Should you accidentally have a bad year, what out of pocket are you comfortable with? Should that happen? What can you budget for yourself? And then, a carrier that's reliable, the claims are paid on time, customer service, they're friendly. These are all huge things that come into, selecting the plan here. So these are kind of my key pieces to note here. Now, I throw my information here at the end. Again, here's my direct line, my email, the website, everything's listed right here. Huge thing I like you to make sure you remember is there is no cost for working with us. So we are specifically, looking for these plans and shopping for you. Brokers are reimbursed or compensated by the insurance carriers. And, we are, again, shopping specifically to make sure that, all of the things that are important for your insurance are in your plan. So I truly don't care which route we go, but I like to show you, again, which route is most suitable for you and then explain to you why. So, again, working with the brokers at no additional cost. We do this every single day. So let us, help you with this process. It's extremely overwhelming. And if you're getting ready to turn 65 or you're past 65, you know how much, verbiage and mailings and advertisements are out there making this confusing. So please, let me help you. I would be more than happy to, help you with getting your ducks in a row and the whole start to finish process with this. So Please reach out to me if you need anything. Again, my information is there. Thank you so much for taking time out of your day and spending it with me to explain really all things Medicare. Hope to talk with you soon.